I'm Mary Lloyd Ireland, professor at the University of Kentucky, an orthopedic surgeon. I gave this talk at the Kentucky Orthopaedic Society in 2017. It is entitled Physician in Training Advice, the 3 C's: change, control, and character. This was directed at orthopedic residents, but I think it rings true for those of us who have been in practice for quite some time, as I have. I think we all need resilience in our lives. What is the definition? It's the capacity to recover quickly from difficulties, toughness, an ecologic definition of capacity of an ecosystem to respond to a perturbation of disturbance by resisting damage and recovering quickly. So I think that's a good definition of we get perturbated all the time. We get disturbed. So we have to resist damage to ourselves and recover quickly. In ecology, this would be things such as fires, floods, natural and politically forced healthcare changes. So we have to be resilient and get through these changes and work more closely together and communicate. We are the leaders in medicine. We're the ones that see the patients, diagnose, order tests, treat the patients. So we need to be very resilient through these healthcare change times and work together and resume leadership and be at the table when these changes are made. This was a symposium that was at the University of Kentucky. UK Auditorium Marquee had this up. PhDs, Dr. Haramati and Cotton were the speakers, and on the marquee outside of the room, it was billed as building resistance. So managing stress, building resistance, the imperative for self-care for all healthcare professionals. When in actuality, the true name and the true topic was building resilience. So it's very interesting that whoever put that up, which was probably a healthcare professional, put up resistance as opposed to resilience. Little Freudian. Correct title, resilience. Don't resist resilience. Be resilient. Mindfulness. I think we'll hear more and more about mindfulness. And what is that? It's the quality or state of being conscious or aware of something. The mental state achieved by focusing one's awareness on the present moment. Focus in the present, while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations. Even as surgeons, I think we need to work harder at being mindful, at taking care of ourselves, and get into this mindfulness state. It will make us better for ourselves, and we will better be able to treat our patients. There are some clinics, university, that are requiring mindfulness training. So is it mindful, as you see on the left, or should it really be mindful, where we're thinking of other things and cleansing our minds? Sounds warm and fuzzy, but I think this is real and we need to be more mindful. Mayo Clinic School of Continuous Professional Development is requiring mindfulness training. There are courses that are taken online and other courses that are person to person, so to speak. Optimizing provider potential, beating burnout. We can have burnout in a lot of different areas in our lives, and we need to be mindful of that and create mindfulness to make us better doctors and to make us be able to practice longer if that's what we want to do. What's a mentor? It's a wise and trusted counselor or teacher. What do these peer mentors do? They instill confidence, enhance social skills, enforce reliability. The word mentor comes from Greek mythology with Timaculus, and he was assigned a mentor by his father. So in summary, you young orthopedic surgeons, physicians, and us older ones should heed this. Be a leader, be the head coach, think outside of the box, be positive, be passionate, be like Jean-Luc Picard. Pay attention and drive the USS Enterprise into the future. Be in control. Be Jean-Luc Picard. I visited Duke for a meeting and went in Camden Arena. They have a great museum right next to that. And this is Coach Krzyzewski's quote, "I don't look at myself as a basketball coach. I look at myself as a leader who happens to coach basketball." And I think this is the way we physicians should look at ourselves. I don't look at myself as a orthopedic surgeon. I look at myself as as a leader who happens to be an orthopedic surgeon. We are all leaders. This is Dr. Frank Bassett, a Kentucky native who served as the team physician at Duke for many years, and he is in multiple Hall of Fames. Best Medicine, a physician's guide to effective leadership. Again, we are leaders. We need to take that leadership banner and be at the table. Be a leader who brings about healthy change while remaining true to the ancient commitments of the founders of this profession. This is another book, The Creativity Cure, written by Carrie Barron and Alston Barron. I heard Carrie, who's a psychoanalyst, speak, and she is a great speaker. Alston Barron is a orthopedist who is a hand surgeon, and they live in Austin, Texas. So this is how to build happiness with your own two hands. We surgeons like to do things with our hands. And whether for me it's oftentimes taking pictures, I like doing something with my hands and creating. For some, it might be doing athletics, it might be running. Do something to reset your mind and be mindful and physically feel better. I would suggest this is good reading for all of us. The Creativity Cure, do-it-yourself prescription for happiness. Expect the unexpected. We talked about change. You never see it coming. Bad things do happen to good people. This is Sheryl Sandberg's book, Option B. It covers facing adversity, building resilience, and finding joy. Sheryl Sandberg is with Facebook, CEO, and that's her picture on the right with her author and counselor Adam Grant. Her husband, who was the SurveyMonkey CEO, died suddenly of a heart attack. And this book came from What Are My Options? So you never see it coming. This will help you prepare for changes, whether it's loss of a friend or a family member, change of job, or other losses. So I would highly recommend Option B. Dr.Ben Kibler and I gave this presentation. Dr. Kibler started in practice a little bit earlier in Lexington. We have always been friendly competitors. He has really been able to establish excellent research in private practice at the Lexington Clinic throughout his career. And his topic with this physician in training advice was based on Stephen Covey's work, Start with the End in Mind. Stephen Covey published The 7 Habits of Highly Successful People in the 80s. And a lot of these principles remain true with how to combine your career and life. So in your life, you will have 4 aspects: personal, social, spiritual, and professional, as abbreviated here. And in different times of our life, some of these boxes will be bigger, and this will change. So it is important for you to try to put a percentage on how much of your life are these. So at some parts of your life, your professional life, as in this diagram, would be very big, maybe when you're starting into practice. And your personal life may be second. And then your social and spiritual life may be smaller. This is training early in your career and sometimes your entire career. It is interesting if you have others in your lives do a similar diagram and tell you where they think you're spending your time, and that may give you a good reflection on if you're spending your time wisely, and also look, are you happy and passionate? So again, the time spent in our 100% of life can change. So now you can see the professional and the personal life are getting much closer together, whereas the spiritual and the social are still down. This is when you're pursuing your personal careers, goals, and again, you need to see what is the best balance for you, and also ask those, your loved ones and your friends, if this is really what you're doing. This may be what you perceive, and they may think that there's a different way that this is divided up into these 4 aspects. Difficult life situations, sometimes the spiritual can be the greatest, followed by social and then professional and personal. So again, these difficult life situations are going to happen, and you'll see a difference in the way that these 4 aspects take up your time. These areas will change in size throughout your life depending on your circumstances. Periodically, again, get somebody else, relatives, friends, give you an assessment of what these percentages are. And there's no area should ever be excluded. Try to emphasize balance between the areas. This is great advice. Always fit your medical career into your life, not your life into your medical career. Say it one more time. Always fit your medical career into your life, not your life into your medical career. It's your funeral. Representatives of 4 aspects of your life: personal, social, spiritual, professional. What would you like these representatives to say? If you can write your own obituary, what would you like these individuals to say? Live your life so they can honestly say those words. Circle of life. The week before this talk, the Las Vegas massacre occurred. 58 people were killed. My husband's audiovisual company, Post Time, had 2 individuals there live streaming this country western concert. They didn't expect to be in the middle of a war zone, but they were. So we need to support each other. Bad things are going to happen. There was blood all over the place. They have worked with me doing surgical tapings, but nothing like this. So we need to support each other, talk to each other. If you find somebody might be depressed, talk with them, get them help. We are going to work to get these 2 individuals some stress reduction, psychological assessment for them and their families to be able to talk about this harrowing experience that changed them for the rest of their lives. This is the medical team at the University of Kentucky in the late 80s. I'm on the right. Al Green is next to me, Sue Stanley next to her, and John Perrine is our internal medicine physician. Circle of life. Al Green left when I left the University of Kentucky, and he lives in Florida and works at Florida Southern College. He is an athletic trainer, not at a D1 school, but enjoying his career and is passionate. His wife, Sue Stanley, is an educator and an athletic trainer and works at his side. Al's grandson, Dalton Green, became very ill recently. And so Al worked for Coach Curry on his staff and for Coach Claiborne. And now Al Green is standing next to the University of Kentucky football coach now, Coach Stoops, and the starting quarterback, Stephen Johnson. And Al's son, who is over Dalton, who's lying in bed. Fortunately, Dalton is getting better, but all of a sudden, this young 11-year-old stops walking. They thought he might have meningitis, but he has a condition called ADEM, acute disseminated encephalomyelitis. 1 week later, he is making significant improvement, and the doctors, the neurologists are amazed, and a lot of it was about love and prayer and really a positive attitude that Dalton was going to get better. So the circle of life, Al Green's on the sidelines with other coaches, and then he's in a hospital bed next to his grandson, who fortunately is improving. So change is going to happen. Expect the unexpected. Pam Whitehead, a very good friend of mine who was in industry, in medicine, orthopedics, and again, a male-dominated profession, the brace business and orthopedic industry. She died of metastatic breast cancer at age 54. She had had a diagnosis 2 years previously, so you never see it coming. Dr. Frank Noyes wrote and delivered her eulogy, and she was described by Dr. Noyes as she was all in for life and fully committed. So hug your friends and families. You never see it coming. Pam Whitehead is a great person, was a great person, and her daughter, Mackenzie, is the spitting image of her, so she lives on. Support those that you can, as long as you can. This audio clip is from David Foster Wallace's commencement speech at Kenyon University. I would strongly suggest that you listen to the whole 20 minutes, but it gives us pause and thoughts about perceptions of things, and this is a very good commencement speech. This is water.
Greetings, thanks, and congratulations to Kenyon's graduating class of 2005. There are these two young fish swimming along, and they happen to meet an older fish swimming the other way, who nods at them and says, "Morning, boys, how's the water?" And the two young fish swim on for a bit, and then eventually one of them looks over at the other and goes, "What the hell is water?"
Thank you very much for your attention. My website is myname.com. Look up other presentations or information on this website.